So it's it can be very difficult to find the right care at the right time to move through illness, especially terminal illness or complex illness. Your needs change over time. But one thing to really bring up here is the notions of hospice and palliative care. And these are very confusing. They're very confusing definitions for what is hospice and what is palliative care. People think of these terms differently. So if you're a little confused about what these services do, you're not alone. So let me just say, palliative care and hospice are not one and the same thing in the US. They're very related. In other countries, very often they're one and the same thing. But here they're a little bit different. Hospice has been around since the 1980s in the US and is an insurance designation. There's a hospice benefit. But to qualify for hospice, the doctor needs to say that you likely have 6 months or less to live to qualify for it. And if you elect to go with hospice, you give up other kinds of care. You stop trying to cure the illness per se. And in hospice, the focus is on your comfort. So there's very often a doctor, a nurse, a social worker, chaplain, volunteers, art therapists sometimes, many other folks, but all of that effort is really around your comfort and the phrase quality of life, which of course is subjective. You get to tell your hospice provider what quality of life means to you. But these guys can be very, very good at symptom management, pain management, etc. So you can be as comfortable as can be. So that's hospice. And hospice is really very relevant towards the end of life in the last, say, 6 months or so. Again, in medicine, we're very clumsy at prognosis. So it's very hard for us to say you absolutely have 6 months or 8 months or 1 year, etc. So it's a best guess from your doctors. And by the way, on the hospice benefit, sometimes if you live longer, that's okay. Of course, that's okay. We want you to live longer, and you might re-enroll for another term in hospice. Sometimes people are in hospice for a year or more. Sometimes people graduate from hospice alive and ends up not being end of life care. Either they go into remission or a new treatment comes online that allows for more life. And so sometimes people come off of hospice and restart their standard care. So that's hospice. Hospice is a subset of palliative care. Again, this gets very confusing, but palliative care is just the overarching discipline that's been around now. It's officially since 2006, but in some ways it's a very old kind of care, which is palliative care is simply the interdisciplinary pursuit of quality of life. And our job in palliative care is to mitigate your suffering, to help you find meaning. So it's less about treating the disease and much more about treating the person or treating their suffering. And hospice is a subset of palliative care. They share the same kind of expertise. But palliative care, unlike hospice, palliative care can be involved at any time along the way in the course of illness. So it's not limited by the insurance designation of 6 months or less to live. In my palliative care clinic, I have seen people for many, many years, 10 years, 12 years. And either way, whether the person's in hospice or palliative care, my job is to tend to their comfort, help them find meaning in their experience, help them reach quality of life, tend to their family. Much of the work is the same thing, but it's not limited by a terminal diagnosis or months until you have months to live. Palliative care, so the bottom line is palliative care can be involved anywhere along the course of illness. A good time for a patient or family member to consider palliative care is when symptoms are undertreated. If there's just a lot of pain and suffering and anguish that the rest of the healthcare system isn't tending to. We tend to be very good at communication. We tend to be good at navigating family dynamics. We tend to help people understand their decisions, their choices, and help them make choices that are right for them. Because again, medicine, the medical system is its own world with its own language and can be difficult to navigate. And
那安宁疗护的照顾目标呢，不在于治愈疾病，而是在于解决呢病患他们在身体上、心灵上、情绪上的疼痛还有痛苦。那安宁疗护的目标呢，在于维持病患的生活品质，让病患能够有尊严的活着，并且还有尊严的经历这个死亡的过程。那如果今天病患的医疗目标呢，是在于想要接受所有可能的治疗来维持生命、延长生命，那安宁疗护呢就不是一个最适合的选项。缓和疗护呢也是一样的，他们缓和疗护的目标在于帮助患者呢疏解他们身体、还有情绪、还有心灵上面的痛苦，所以这方面呢是和安宁疗护是非常相像的。
安宁疗护，也就是说，一个病人他被医生诊断，哦，你的生命只剩下大概最后的6个月、半年或者是更少。这个时候呢，家人就需要考虑安宁疗护了。有很多病人的家人都是说，哦，我们如果知道病人会减少痛苦，得到比较舒适的照顾，我们会早点考虑安宁服务。致力于舒缓疼痛，令病人舒适。他们不会再继续寻求治好病，因为这个阶段的病人再去做治疗，也就是说你的生命只有6个月或者更少的时候，你再去做治疗可以说是弊大于利的。我们说安宁疗护是有一个团队的，医生有的时候会去看病人。那我们的护士也常常会有1个礼拜去探访1次病人，甚至在紧急的时候，马上就会有护士到家里，或者是到一些疗养的地方去访问病人的。另外在这个过程中，我们知道病人是我们需要照顾的，让他不再疼痛了，让他在身体上得到一些舒缓呢，这些但是我们也要考虑到家人，有的时候家人他们会在这种状况下会感觉到非常大的压力，照顾的压力啊，亲人要走了这种伤痛的压力啊，还有呢就是说对于很多未知药物怎么使用啊等等的压力。就我们的一个小组通常是护士、社工和灵性辅导师去看他们，灵性的辅导师主要的就是针对家人，因为家人在这个时候的那种感受是非常需要倾诉，非常需要得到一些人的安慰、聆听的。所以呢，灵性的辅导师常常会到家里去可能有一些家人会觉得我需要护士就够了，但是呢，要知道我们在一些特别的关头、一些危机的时候，我们可能不是太晓得怎么样舒缓自己的情绪，照顾好自己的身体，因为家人的身体好，对于病人是一个福气，他们才有能力去照顾病人。那么他们的一些压力需要舒缓，所以我希望如果有这些安宁病人的一些事情发生的时候，你们真的需要去了解这个安宁服务的这个小组尽量得到更多的支持，包括病人身体上的支持，还有心灵上家人的情绪的舒缓，这是一个非常好的服务，大家可以考虑。而且呢，还有一点我想补充，就是有家庭护理会上门来帮忙病人做一些清洁的工作，清洁洗头发或者是抹身体这样子会减轻家人很多的负担。我想这是一个很好的服务每一个家庭如果有重症的病人可以考虑这种服务的。
I know this can feel very confusing. It's confusing to a lot of healthcare providers. A lot of doctors don't really know what palliative care is, and they don't really know when to ask for a hospice. So another note here is for you as the patient or as a family member it may be on you to bring this up with your doctor. They often forget to bring it up or don't understand it themselves. So you might ask, hey, would palliative care be appropriate here? Or, hey, doc, what about home hospice? If you're really bold, you can even ask, hey, doc, do you think death might come within the next year or so? And if they say, well, maybe, that's a good time for you to consider hospice. That's a nice way to prompt your doctor to think about hospice. The point here is these are little understood types of care, and it's often on the family member or the patient to advocate and to push for these things and to ask for these things. And as Grace was saying, a great trick can be to call up a local hospice agency. Most people live within the purview of a hospice agency, and many of us live within the range of multiple hospice agencies. So you can shop around, but a great idea is to call and request what we call an informational interview. And that's just, they'll just come to the house or get on the phone with you and describe what they can and can't offer. It can be very helpful. You don't need to sign up. And even if you sign up for hospice and it doesn't feel right, well, you can come off hospice any old time. So the stakes are low. Most people wait too long to include hospice or too long to ask about palliative care. And in so doing, they're suffering more than they need to. And another thing to mention here, guys, is it comes up oftentimes is it feels like choosing hospice can very often feel like giving up or quitting. And that's very hard emotionally. It's importantly different than, giving up is very different from yielding to what will be, to the truth of illness or the truth of nature. That's very different from giving up. So this is where these things can get very tricky, and you have to make sure to talk these things through. Because maybe it was you, Zuning, who said earlier, sometimes more treatment, while you're likely to have a doctor offer you more treatment, oftentimes more treatment is actually not helpful and can be hurtful. Chemotherapies, for example, in the setting of cancer, sometimes when we're too weak to accept it, we can hurt ourselves with treatment. And this gets to yet another point here, which is, and we know this from studies, that hospice and palliative care, this approach to care, not only does it not shorten your life, it can actually help extend your life, which makes sense. When someone's tending to your spiritual needs, your emotional needs, your family's needs, and not necessarily pouring treatments into your body if it can't handle it, well, that's an unburdening of its own kind. And sometimes we actually live longer with these modes of care. So it's complicated. I know we're saying a lot now, but this is all the more reason to simply ask your doctor, ask your nurse, ask your medical team, ask around, talk about these things, advocate for these things. Let me just simply say in summary, hospice and palliative care are in many ways one and the same things, but slightly different. Both hospice and palliative care is a type of care that is focused on your comfort, on your spiritual, emotional well-being, and is not trying to fix you. With palliative care, we're trying to help you deal with the situation you have now. We're trying to help you deal with reality you have now. So within that difference, though, hospice is the type of palliative care that's reserved for the very end of life, the final months of life, whereas palliative care you can get anywhere along the course of illness, and you don't have to give up other modes of care to get palliative care. So I hope that makes some sense.